I will be talking about skin bleaching in Africa, focusing on the diffusion of skin bleaching and the negative effect it has had on African health, specifically due to behaviors of African women. Skin bleaching began in Britain with Queen Elizabeth I. The more porcelain one looked, the more beautiful one was. It was seen as a status of wealth. So if skin bleaching originated among white Europeans, how did it spread and become so prominent throughout Africa? This is a map of African colonization. The blue represents areas the French colonized, and the orange represents areas the British colonized. Now take a look at some of the places that experienced the most skin bleaching. These areas correlate with French and British colonization. It is reported that 77% of women in Nigeria, 59% in Togo, 35% in South Africa, and 27% in Senegal practice in skin bleaching. When the transatlantic slave trade began, skin color was used to separate free people from slaves and to rationalize the enslavement of different races. Colonizers designated melanin-rich skin tones inferior. There is a rich history surrounding the diffusion of skin bleaching into Africa and African communities through colonization and imperialism. Professor Shirley Ann Tate, a cultural sociologist at Leeds Beckett University, stated that during the colonialism and enslavement, being white was about being free. Being light-skinned was about being more beautiful. Being light-skinned was also about maybe being able to negotiate your way out of enslavement to freedom. She continues, when you have a situation like enslavement and colonialism, where you have societies which are very structured racially, where white is always at the top, of course you would have people trying to negotiate the market in skin shade. In an article titled Skin Bleaching and Global White Supremacy by way of introduction, Yaba Blay, a professor at Lafayette College, stated that while the history of skin bleaching can be traced to the Elizabethan age of powder and paint, in its current manifestations, skin bleaching is practiced disproportionately within communities of color and exceedingly among people of African descent. A study led by Kelly M. Lewis, Department of Psychology at Georgia State University, examined the psychology of this phenomenon. Why do women continue to bleach their skin knowing it will cause damage? A large group of women in Tanzania was questioned and gave 6 main incentives as to why they bleach their skin. The first was to remove rashes, pimples, and other skin problems. Then it was to have softer skin, to be more European looking, to remove the harm that came from previous bleaching, to please their partner or appeal more to men, and lastly, to impress their colleagues. This study concluded that these findings provide empirical support for skin bleaching being linked to self-objectification, colonialism, and westernization. Although skin bleaching diffused through colonization, it remains a common practice today. In fact, it is increasingly more common around the world in the past 30 to 40 years. Naomi Julian of Georgia State University stated that South Africans have not overcome many of the psychological effects of colonialism, some of which are self-hatred and low self-esteem. Ngunen Adam, a British journalist originally from Nigeria, wrote of her first-hand experience, saying that in Nigeria, being fair gave you access to hot bachelors and a lifestyle that only light-skinned women could enjoy. Bleaching can increase rates of infertility, skin cancer, and serious skin, brain, kidney disease, irreversible skin damage, and leukemia. One of the most common ingredients in skin bleaching is mercury. Mercury inhibits melanin to form. Melanin is pigment in the skin that makes the skin appear darker. It is produced to protect our skin from UV rays and skin cancer. When melanin cannot form, cancer increases. In addition, hydrochloric acid exfoliates and lightens the already tanned outer layers of the skin, causing even more problems. Yet women still use this project. A study led by Iwon, a faculty member at Chika Anta Diop University in Dakar, Senegal, sought to find prevalence of bleaching despite the knowledge of its harm. He conducted the study on 600 women from 15 to 55 years old. The study revealed 67.2% of women use skin bleaching, the majority in their 30s. In addition to this study, studies conducted in Mali and Togo gave comparable results. This behavior has led to increasing health issues throughout Africa. Ghana, Côte d'Ivoire, and Rwanda have begun banning skin bleaching products, but more needs to be done culturally if there is going to be a real change.